you may start your presentation.
Okay, Assalamualaikum and a very good afternoon to our beloved lecturer, which is Madam Diana. Okay, today we will present about the analysis of worldwide COVID-19 and COVID-19 dates in Malaysia. Before beginning, I would like to introduce ourselves. First, me, myself, Amalin Hasha binti Muhammad, and my teammates is Nur Alia Farisha binti Muhammad Shahrin. Okay, the type of chart that we use in this presentation is a bar chart. Okay, the purpose of the chart for the chart one is to show the number of COVID-19 deaths in Malaysia, and the second chart is to identify the global spread trend of COVID-19 cases. Now I will pass to my team members.
Thank you, Amalin. So, may I start with the introduction? COVID-19, one of the biggest global health crises in recent history. The global spread rapidly across many countries and affected millions of people worldwide. During the pandemic, many countries experienced increasing numbers of infected, hospital admissions, and deaths. In Malaysia, COVID-19 not only caused a rise in confirmed cases but also led to many deaths among patients related treatment in hospital, as well as individuals who died before reaching medical care. We chose this topic because COVID-19 affected all of us personally and globally. During the pandemic, we experienced lockdown, we experienced online learning, movement restrictions, and concern about health and safety. Many families lost loved ones while healthcare work struggled to manage the increasing number of patients. Next. So, for the central idea of this presentation is to analyze the worldwide spread of COVID-19 cases as the pattern of COVID-19 death in Malaysia. Through this analysis, we can be better understand the severity of the pandemic and the importance of public health awareness and early treatment. Now I will pass to Amalin.
Okay, now I will explain about the background of the topic, which is we know that COVID-19 is an infectious disease caused by the SARS-CoV-2 virus. Okay, there is a factor that contributing to the spread of the COVID-19. The first one is a limited public awareness about the disease and its prevention method. And the factor number two is the large gathering also increase the risk of the people were in the close contact with each other. And the last one is the poor compliance with the standard operating procedure SOP, such as wearing face masks and maintaining a distance can contribute to the spread of the virus. Okay, next I will Okay, next I will explain about the chart number one, which is the chart show that the amount of inpatient dates and the broad index BID in Malaysia in 2021. As we know, COVID-19 can occur in hospital. COVID-19 deaths can occur in hospital or otherwise. So in Malaysia, COVID-19 deaths occurring outside of the hospital and subsequently brought to the hospital are known as a broad index or we call as a BID cases. First, I will explain about the inpatient days, which is okay, in early week of 2021, the number of inpatient COVID-19 deaths in Malaysia remained relatively low and stable, with only slight increase recorded during this period. So, beginning around the epidemiological week 18, the number of inpatient days started to rise gradually, showing an upward trend in the graph. A sharp increase can be clearly observed between week 27 to 30 to 32, where the number of deaths rose rapidly within a short period of time. Okay, and the graph showed that the highest number of inpatient COVID-19 deaths was recorded around the week 31, reaching approximately 1,800 deaths. And after reaching the peak, the number of inpatient days began to decline gradually toward the end of the year. Okay, the second one I will explain about the numbers of birth index BID, same as the inpatient deaths, where at the first at the early week of 2021, the cases remained very low and stable with only a minor changes shown in the graph. So around the epidemic epidemiological week 20, the number of BID cases begin to increase gradually, okay, where the indicating a rising trend over time, and a significant increase can be observed between week 27 and 32, where the number of BID cases increase within in a shorter period. And the graph also showed that the highest number of PID COVID-19 cases was recorded at approximately 615 cases around week 32. And after reaching the peak, the number of PID cases gradually decreased and continued to decline steadily until the end of the year. That's all for the chart number one. Now I will pass to my teammates.
Thank you, Amalin. So continue with the chart 2, which present the daily new confirmed COVID-19 per million people in 2021. The data for this chart was taken from the World Health Organization or WHO. So this chart, as you can see, is a horizontal bar chart that compares the number of COVID-19 cases among other countries. The x-axis represents the daily confirmed cases per million people, while the y-axis lists the countries involved in the study. So based in the chart, Ireland recorded the highest number of daily new confirmed COVID-19 cases, which 914.283 cases per million people. This was the highest figure among all the countries shown and indicates the Ireland experienced a very severe spreading of COVID-19. So based on the chart 2, the next is Singapore and United States recorded 257.780 and 247.087 cases per million people respectively. Maldives and Italy also show relatively high number with more than 180 cases per million people. Meanwhile, Vietnam and United States recorded 257.780 and 247.0787 cases per million people respectively. And Brunei, Thailand, South Korea and South Africa recorded lower number and daily confirmed cases ranging between 60 to 140 cases per million people. So at the bottom of the chart, Palestine, India and Saudi Arabia recorded the lowest figure. Saudi Arabia has the lower rate overall, with only 1.012 cases per million people, while India recorded 6.2 to 5 cases per million people. So, this chart 2 overall is clearly shows a large difference in COVID-19 infection rates between countries. That's all from chart 2.
And now I will continue to conclusion. So the Malaysia faced a much harder challenge with COVID-19 rising sharply. Okay, because for example, the increases in BID cases highlight the importance of obtaining early medical attention. And the second one is the virus move around the world, so there is no country is completely safe from the virus, as the COVID-19 can spread rapidly across border. So all the countries will making an international cooperation essential. Therefore, countries need to continuously share the data and resources to help monitor the situation and prevent new surges from spreading between regions. So that's all from
That's all
us.
from us.
All right, thank you so much. Do you